Hi there. Apologies with the earlier stream. There was some glitch happening, but let's just quickly restart with where we were. We were talking about Mahendra Singh Dhoni's surgery. Now, we here at Sports Today, just about a few hours back, we told you we were one of the first ones to tell you about Mahendra Singh Dhoni undergoing his surgery, and it was successfully conducted at the Kokilaben Hospital in Mumbai. Now, the Chennai Super Kings CEO Kasi Vishwanathan also gave a confirmation about the surgery. He said yes, everything went well. He also had a word with Mahendra Singh Dhoni and he said that Dhoni sounded absolutely fine after the surgery. This is perhaps one of those pictures that was doing the rounds during the course of the IPL, wherein you could see Mahendra Singh Dhoni's left knee being heavily strapped, and there was a ice pack as well. You know, there was part of it. So what exactly was that surgery that Mahendra Singh Dhoni went through? We're here to tell you about the nitty-gritties of the surgery, what exactly were the procedures that were followed, and how exactly could Mahendra Singh Dhoni's recovery look like. We're going to answer all those questions that you possibly may have in your minds right now. Let's, without any further ado, tell you what firstly was the surgery that he underwent, the name of the surgery, what procedure, how long it possibly took for it to be operated, and over the next couple of minutes, just be with us because we're going to be telling you all those details. Now, it is, for starters, it's the keyhole surgery that Mahendra Singh Dhoni underwent at the Kokilaben Hospital. He did that immediately after the conclusion of the IPL final, which he won for the Chennai Super Kings for a record equaling 5th time. Now, it is, by the way, the keyhole surgery is also called or also rather known as an arthroscopic surgery to begin with. The procedure that was followed for Mahendra Singh Dhoni's surgery was largely arthroscopic in nature. What also we know about the surgery is the fact that it is not an open procedure and one does not cut open the whole knee. So unlike other procedures which are far more complicated, let's say the multiple surgeries that Rishabh Pant had to undergo, those were the ones in which those were far more complicated, and which is why you see a longer recovery time as well. And there's one more thing about that Pant surgery and that and the Mahendra Singh Dhoni surgery, which we'll be talking about in just a bit. But unlike that, this does not involve any big incisions on the body, and it does not cut open the whole knee. This is what we know as far as Dhoni's surgery is concerned. Now, you'd possibly be asking as to what exactly happened, or that could be the next question on your mind, that if the whole knee wasn't cut open, how is the surgery then possible? Well, it's the arthroscopic procedures that were followed, and what happens usually in arthroscopic procedures is that you usually just have very small incisions on your body. Now, what also happens in these procedures is that this just about 3 to 4 insertion points that get made on the body, and in Mahendra Singh Dhoni's case, that was around the knee. Now, what happens also is once you have these incisions in place, the doctors then pass a tube right through these holes, and what you also do is you attach some microfiber cables as well, which give you an idea on rather a projection. So now there are video cameras that are inserted, and that give you and that gives the doctors an idea, and the certain tools as well they use in these small incision points that they make, which gives them an idea, and it gives them a view of the area that they are treating. Also, what happens with these surgeries, interestingly, is this is usually used only for joint issues, just for diagnosing problems which are concerned, let's say, with the knee, or for other joint areas. Could be the elbow as well. For largely treating joint issues, or rather joint surgeries, you use arthroscopic procedures, and which is what happened in Dhoni's case as well. 3 to 4 points around the knee were made. There were tubes that were passed, and that an image of his knee was then projected onto a screen for the doctors to then go ahead with the treatment. Now, only in cases of ligament repair an open operation may be needed. Now, this is where I want to be talking about Rishabh Pant's surgery as well, and this is where his surgery was far more complicated, and that also reflects in the recovery time then. Now, Mahendra Singh Dhoni's surgery wasn't an open surgery. In Dhoni's case, this was, you had these small insertion points that were made, and it was something for which the entire knee didn't have to be cut open because there wasn't any ligament damage that Mahendra Singh Dhoni underwent. But in Rishabh Pant's case, he had undergone ligament tear as well. His ligaments were damaged, and which is why his surgery was longer, the recovery period is far more, and the surgery was also very complicated. Now, the last question that you perhaps would, and by the way, very interestingly, before we move ahead and talk about the recovery time, the doctor who treated Mahendra Singh Dhoni was also the same doctor who had treated Rishabh Pant as well just about a couple of months back. So that's the only common thing you can say between the two surgeries, and that doctor happens to be on the panel of the BCCI as well. He's one of the senior most doctors, in fact, in Mumbai when it comes to dealing with such injuries. As far as lastly the repair and healing time for Mahendra Singh Dhoni is concerned, it is believed to be under 3 months. This is mostly the case in most arthroscopic surgeries as well. The recovery time is usually 2 to 3 months, and in MS's case as well, you see a 3-month recovery time here as well. So this is all about the keyhole surgery that Mahendra Singh Dhoni underwent. If you're joining us right now, do just go back and have a look at all the details about Mahendra Singh Dhoni's keyhole surgery that we've shared on this video. We hope you liked it. In case you did, do show us some love. Do like, share and subscribe to Sports Day. And like we always tell you, do press that bell icon so that you know every time we go live. Thank you so much.